morning. Thank you for listening to Community Access. My guest this morning is Dr. Abbas Mohammadi, founder of Columbia Dental. Good morning.
Good morning, Alison. How are you?
I'm doing great, thank you. How are you?
Excellent.
Today we're going to talk about oral surgeons and wisdom teeth. Tell me, for those who don't know, what does an oral surgeon do exactly?
Oral surgeon has a very broad scope of practice as they are dealing with any trauma in the jaw. Also, they are dealing with removing any pathology, biopsy, etc. But one of the main scope of the oral surgeon, and that's in a mainstream perception of the oral surgeon is the doctor that removing the wisdom
teeth.
Yeah.
Yeah. That's
So
what we think of.
that's all it is. So and why the wisdom teeth need to be removed or when need to be removed and all those things is something that is worth it to address. That is first of all, third molar or wisdom teeth are the last teeth in our jaw, and a study shows that even you have your wisdom teeth, if you don't have your wisdom teeth, you have the same chewing capacity. So basically, there are useless teeth that they're not participating in anything. So the theory or the evolutionary theory is that we have the gene for developing the wisdom teeth. However, in certain individual, the jaw or the bone cannot compensate for it. So because it's smaller, and the reason is that if you go to the National Museum in New York City, you will see our ancestors, they have a way larger jaw. Or if you believe we came from monkeys, they have way bigger jaw than humans. So the jaw could compensate all the 32 teeth. But as innovation of the fire, our diet it become softer, so our jaw start to shrink, and because we don't need that big of the jaw, we don't eat raw food or raw meat. Put it that way. Still, we eat raw.
So we just evolved with a smaller jaw?
A smaller jaw. But in many people, still we carry the gene. So in biology, the change in the morphology, it called phenotype. So our phenotype changed, but the genotype is still in many individuals stay the same. So that means we have the genes to have 32 teeth, but we don't have no room to compensate for it. As the result, in many individuals, is those wisdom teeth, it become impacted. That's why they need to go see the oral surgeon, and they have to open up the gum and removing those teeth that is embedded in the jawbone. And what happens if you leave it? They wanted to erupt because like any other teeth, they wanted to erupt. And as the result, they're not able to erupt because there is no room for them. So they keep putting pressure on the adjacent teeth, on the jawbone. As the result, you might, patients, they may develop cyst, pathology in their jaw. So from a preventive point of view, we recommend all the impacted third molar to be removed. Obviously, we want them to be removed at earlier age, because as we get older, healing it become more difficult. Now, if the wisdom teeth it become erupted, and of course they're not going to put the pressure on the jawbone and etc. But still, they are useless teeth. They are all the way in the back, and from the preventive point of view or hygienic point of view, still we recommend those those third molar to come.
So, is there ever a time that they're just beneath the surface and they don't ever affect the teeth and you could just leave them alone?
No, they affect the teeth. They no matter what, they affect the teeth. However, like any other surgery that you perform, there are risk and benefit there. So if the risk outweigh the benefit, of course we monitor. If the benefit is better than the risk, we remove it.
Because I've heard people say, my wisdom teeth never came in and their teeth weren't affected and no cysts, etc. But you're saying really they should still be taken out.
Correct. Of course, it looked like you're saying that, hey, I'm smoking 40 years and I don't have no lung cancer. So that doesn't mean because in certain individual you didn't get any pathology or risk, it's not a good idea to leave a risk factor within your jawbone. For that reason, in many countries, including England, that they have a healthcare system that the government pay for it, is it's kind of mandatory that they go to schools and the teenager they remove their wisdom teeth as a part of the health plan, because they know if they leave down the road is going to cause more complication and more cost to the healthcare system rather than to live it. Of course, it doesn't happen in every case, but for God's sake, you said somebody develop a cyst at age 40, 45, it is going to be more burden on the insurances and the government expenses, and also it's not good for the patient because at that time you're not healing as good as the teenager they do. Usually because as we get older, the bones get more brittle and also the root form. So you need to remove more of the bone structure to take the wisdom teeth on a 40 years old rather than you remove the wisdom teeth on a teenager on 18 or 19 years old. So they are easier to be removed.
So when you said an earlier age, you were referring to 18, 19 as they're either coming in or they're in there.
Yeah, we recommend between 16 to 20, 21 are the best ages to do it. Of course, individual are different, not always biological age, it's coincident with the chronological age, but around 16 to 21, sometimes we have removed the wisdom teeth even at age 14, depend on the development of the teenager or the child.
When I had my wisdom teeth out, I looked like a Campbell soup kid. Do you know what I mean? Like the cheeks like this, and my lips are all, and I had dry sockets.
Those are, again, it's the complication can happen at any age, but those complications usually happen when we get old. In a younger kid, those complications is less to happen.
Really? Because I was younger, and the dentist rather, he gave me, it looked like a little brown cream. It didn't look very pretty.
Yeah.
It immediately stopped the pain. I mean, because the dry socket was extremely...
That was a dry socket.
Yeah.
Doesn't smell good, but it relieved the pain. Correct.
So when it's a dry socket, it didn't clot? I
Correct. What is dry socket? It means when we do the extraction, and that doesn't happen only in wisdom teeth. It can happen with any type of the extraction. What happened, after extraction, you're expecting the blood clot goes and form within the socket or the hole. Sometimes they don't happen. has many other reasons that dry socket happen. Some people they don't heal well because their immune system. Some people are a smoker. It has to be done also with the technique you use to do your extraction. So it can be dry socket. Sometimes we just simply iatrogenic caused by bad techniques or whatever, or can be something more than that. But it can happen.
What's so interesting is that my dad had dry sockets, and he said to my brother and I, if you have that, because you have pain regardless,
Correct.
but you know the difference between a dry
Correct.
socket, and because he did, I did, and my brother did, almost like there was a genetic component.
It might be a genetic component, but also again, it has also does with the techniques. For that reason, most of our extractions that we do at on Columbia Dental done by specialties or expert in the exodontia. So because many times by raising a correct flap and closing properly the gum, those dry socket it may not occur. It doesn't mean even you can do everything perfectly fine, but it still can happen. But
Yeah.
of course, if expert does the procedure, there is less possibility of having a dry socket.
Yeah, I just tell everybody who goes, if you really feel like something's not right, just call it, because it's so simple. They just give you the cream and you feel better immediately.
Yes, sure.
I don't want anybody to suffer. Let's talk about the removal of wisdom teeth. I'm going to age myself, but I want to say that my teeth were probably coming in, because I had two different surgeries, one for the bottoms and then one for the tops.
Okay.
They didn't do all four at once. They did two
okay.
at one time. So I want to say, because I'm Italian, this old Italian dentist, I don't think he gave me anything. I feel like he just went in my mouth with some like pliers maybe and just yanked them out. That was it. And then another time, they put me under and they removed them. And I had that, like, how do I say it? Like a reaction afterwards where I was crying. Is it the laughing gas, doctor?
It could be a laughing gas, or could be the sedative that they were using it. Okay, that has some complication. Again, for everything is a risk and benefit. I do believe that if a profound local anesthesia be done, there is no need to go under. Going under is something that is an additional cost to the patient, and most insurances they don't pay for sedation because they don't consider that really medically necessary. It's more than patient choices and preference that is something medically necessary. So would be a additional causes, and besides the sedation, it has some anesthesia, general anesthesia has some risk. Also the risk of minimum or possibility is minimum, but it still exists. So when the patient they choose anesthesia, they have to think about all those possibilities, and of course they have to put it in the economical context, because it make it more difficult. You need to have an anesthesiologist along with the doctor, and is they paying for two doctors rather than paying for one. You know what I mean? And it's not covered by the insurance company. So most of our patients they doing it under local anesthesia, or they getting nitrous oxide or laughing gas, which is not completely go under.
Well, there's so many videos of people who've had their wisdom teeth pulled, and it must be the nitrous oxide
Or it's a laughing
or the laughing gas, where they're just not themselves afterwards, and they're saying silly things and they're crying. That was me.
Correct.
I was saying things, the silliest things to my mother. So, but when you see somebody at Columbia Dental, an oral surgeon, you sit down and they decide what is the best way to extract it.
Correct. And a nitrous oxide really doesn't have that much a side effect besides, you're laughing, which is a good thing.
Yes.
Is not having that much, complication versus general anesthesia. And just changing the subject, because I'm sitting in downtown Hartford, is the first dentist that discover or apply nitrous oxide. Horace Wells was from Hartford,
Wow.
like 2 blocks from here.
It's cool.
Yes, that implemented the nitrous oxide.
So does an oral surgeon need a lot more schooling after they go to dental school?
4 more years training at least. Some of them they go additional 2 years, and they receiving medical degree as well if they wanted to pursue some type of hospital privilege, or they wanted to having more hospital oriented procedure to be done. They don't have to, but it's a good that to have a dual degree there. So between 4 to 6 years they've been trained.
So for people who don't know about Columbia Dental, oral surgeons are just one of the doctors that you have. You have periodontists, etc.
We have all different specialties, and we are working in a very integrated format. So for that reason is, we give the procedure to be done to the proper doctor, to the doctor that feel comfortable and within the scope of the practice.
Now Labor Day, as you always do, on holidays you have free cleanings. For those who don't have insurance, anybody can stop in, first come, first serve. So Labor Day, you're doing a free cleaning again.
Correct. From 12 to 7 in our Manchester location, 483 Middleton Park West.
It is so wonderful. Again, that's September 1st, 483 West Middle Turnpike in Manchester from noon to 7. If you'd like more information about all of their services, all of their locations, it's columbiadental.com. I'm speaking with Dr. Abbas Mohammadi, founder of Columbia Dental. Thank you so much for being here today.
Thank you, Alison.
It's always a pleasure.